I've already done that one. Alright, now we've already had the endocrine pancreas, right? Y'all remember the endocrine pancreas from last year, hopefully? Okay, so look as far as the remember a little bit of review of the structure of the pancreas. It's an elongated organ, basically close proximity to the duodenum, covered by a thin capsule and has sepals that come down through, right? What are the two major components of the pancreas cell-wise? Your islets, which have your endocrine cells in it, right? And your exocrine cells, which are in the acinar. And what's the difference between endocrine and the acinar? The acinar structure has ducts, right? That's why they are exocrine glands. Okay. Right? So as far as the pancreas, you can see the islets, you see the acinar structures in there, basically looking at that. All right? Now, the vast bulk of the pancreas is estrogen. And basically, remember acinar cells are going to secrete their enzymes and things into the duct lumen, and that's going to go through a series of ducts, gets bigger and bigger, until most of it goes out to the common bile duct. And what do we mean by common bile duct? That's the combination where the major pancreatic duct joins with the bile duct, right? What's the advantages of those two going down there together? Does it give you a concentrated surge of what you need to break down that food that's coming into the proximal duodenum? If the bile got there after the enzymes got there, what would happen to your lipase by the time the bile acids got down there to emulsify the fat? It would be gone. Okay? And so basically also remember we have the secretin, which causes the bicarb to be excreted into biliary ducts. And why is it important to have that bicarb coming down? What's the pH of the ingesta coming into the small intestine? Uric acid. What's going to happen to all those pancreatic enzymes if they don't get pH elevated? Well, that's one way you can go on a diet, right? But that's not the good way because it messes up all your metabolism, right? Now, as far as what surrounds the acids? What's that network of your myoepithelial cells? Surround the acinar structures. Why are they important? What's cholecystokinin do to them? Contraction. What's it force out? Pancreatic enzymes, so you can get them secreted down into the gut or excreted into the gut. Okay, so all that stuff is together like that, and basically, so what is the main function of your exocrine pancreas? It's for digestion, right? What are the main components of the digestive processes? You've got fat digestion with the lipases, right? You have starch with the amylase, and you have proteases to break down the proteins. Okay. Do you need the pancreatic secretions to absorb glucose from the diet? Yes or no?
Yes.
No. The glucose is a small sugar, it's not a starch. You don't have to break it down. Okay? Where does the amylase digestive process start? In the saliva. Okay? But where does that amylase go in the saliva? Gets to the stomach, what happens to it? It goes away. So elevated levels of amylase in the blood indicate what problem? Pancreatic necrosis. Okay. Now if you have a sialocele or a blocked salivary gland, that type of thing, or salinitis, that may leak amylase into the blood. But I think you'll all be able to tell that if you got this big bulge under here or this tenderness, that'll tell you what's going on, right? So basically, elevations in amylase and also lipase indicate pancreatic necrosis. Okay, and that's what we use those for. All right. Now, as far as the proteases are concerned, the two main ones we know are trypsinogen and chymotrypsinogen. They're excreted. The trypsinogen gets activated by the proteases and other things, by activator factors, rather, PPL and that type of thing down in the gut. And then the trypsin activates chymotrypsinogen to chymotrypsin. Okay. So when you have pancreatic necrosis or anything. Do you get much of a problem as far as those protease levels in the blood? No, they're not absorbed very well. They get tied up in the damaged tissue, so we don't use those as indicators as far as pancreatitis is concerned. Okay? Now, we're going with this. We've already done that. Okay, the lipase. Is the pancreas the only place we get lipase from? No, there's all kinds of different types of tissues that have lipase. Generally speaking, the only thing which elevates lipase to any significance in blood is pancreatic sources. But we do have a isoenzyme assay we've developed as far as lipase is concerned that's specific for the pancreas. Comes in a nice little snap test, so you can use it very readily in the clinic to make sure that that animal does have a pancreatic problem. Okay? Now, as far as what these things do, I'm not going to require you to go through all these digestive processes, but before boards, you need to know what they do. If you go back and look at those notes on physiological chemistry you had last year and stuff, they give you the steps and everything and break them down. But what would you see in an animal with exocrine pancreatic insufficiency? What would they look like? They're going to be probably getting emaciated and all that. What's the feces going to look like? Usually really greasy, lipoid type, fatty, greasy feces, right? And so that's one of the things that an animal would come in with. Now, what else could be causing the feces like that, though? How about malabsorption? So whenever you have that type of thing, the two main things you worry about are what we call malabsorption and maldigestion. Maldigestion includes exocrine pancreatic insufficiency or liver problems, because you're not getting the bile acids down there to emulsify the fat, so it just comes on out. Okay. How would we rule out the passage problems? Those things we just talked about, right? If you don't have, if all those are normal and everything, then that tells you it's not a cholestatic mechanism or something like that. It's causing that stool to look like that, right? How would we rule out that it is malabsorption? What? Well, look at the lipids. If I feed an animal corn oil, dogs will lap it right up. Feed the animal corn oil. Should I get a lipemic plasma if everything's normal? Yeah. But if the liver was messed up, you won't break it down so you won't see it, but we've already ruled that out, right? Well, if my pancreatic enzymes aren't getting down there, are we going to be able to absorb the lipids to give us a lipemic plasma? No. But what if my enzymes are getting down there, but I have malabsorption? Is that going to prevent me from getting a lipemic plasma? So now, you did that. So what can you do now to differentiate between pancreatic insufficiency and malabsorption? Anybody? How about pre-digesting the fat? You can get pancreatic enzymes, container pancreatic enzymes you can get at the pharmacy. It's across the counter type of thing. But you take those pancreatic enzymes, you mix them with that corn oil. What should it do to the lipid? Break it down so that it can be what? Absorbed. You break it down like that, you feed it, you see lipemia. What have you ruled out? Malabsorption. What have you ruled in? Pancreatic insufficiency. As long as you read the directions. If you mix them and feed them immediately, what is the stomach acid going to do to those enzymes? So that's going to give you malabsorption, whether you have it or not, okay? Does everybody understand that? Okay, so there's tests, because in other words, the pancreas is so involved with the GI tract that when we have problems with it, we have to rule out GI tract problems. Now, as far as those enzymes and, the bicarb, or epithelial cells that are in the pancreatic ducts, as we say, are the source of bicarb and water that's secreted by the pancreas. So, what if I have duct blockage there? Is that going to make the feces a little more, colloidal type stuff? Is it going to basically cause an increase in the pH of the feces when it's coming out, this type of thing? And so basically, there's various things all over the body which can be messed up by problems with the pancreas. That's why it's an extremely important organ. All right. Now, as far as what controls pancreatic exocrine secretion, food entering the small intestine is going to activate, as you say, cholecystokinin. It's also going to activate secretin stuff, so you get the acid, the enzymes down in there, and you got the proper pH down there when you get there. Okay, so basically, a lot of it is feeding. Now, what if y'all right now are thinking about, oh my heavens, how many of you like steak? How many like crab legs? What if you're sitting here and you start thinking, man, I sure could go for some, some surf and turf. If you like lobster too, surf and turf. What's your mind going to start doing? Thinking about that. So is that going to cause the release of like gastrin and then you release those enzymes? So can that cause you to release your enzymes and stuff? Yeah, so in other words, there's also CNS control through perception and that type of thing, which can control these enzyme secretions and stuff like that. Okay? Now, as far as we've already talked about those, y'all need to remember those. You will see them again, okay? And those hormones, again, we talked about these hormones last time, and endocrinology. So let's look at the exocrine here. There's two main disorders: inflammation or insufficiency. Inflammation is what inflammation is, pancreatitis. There's various things which can cause it. Infectious agents, etc. Drugs, all this type of thing can cause it. As far as insufficiency, there's various things which can do that. Lots of times if you've got fibrosis, let's say you have repeated insults of pancreatitis, what are you going to replace a lot of the normal tissue with? Fibrosis. Is that going to be able to secrete the hormone enzymes and stuff? No. So it can be the result of low-level repeat inflammatory processes. And exocrine pancreatic insufficiency is much more common in the dog, because what do dogs like to do if they see some garbage and stuff laying around? They eat it, and sometimes that's not very good for them, is it? It can cause acute pancreatitis. It may not be severe enough for us to detect anything. But if it keeps doing that, over time, you're going to lose pancreatic function. Cats are more prone to get pancreatitis. And one of the reasons is that is because when they do see something they like, they can overdo it, or they eat things like mice and stuff like that, which can cause infectious processes and stuff like that to occur. Okay? So, what type you get is a little bit of species specific. Now, why don't we diagnose pancreatic insufficiency or pancreatitis in large animals more often? What happens when a cow gets sick? They're usually slaughtered. Okay, so there may be a lot higher incidence than what we know of. Horses, the main cause of pancreatic problems is if you have peritonitis. Stuff like that. It's the main cause of that. Okay. Now, basically, some cases of liver disease in calf particularly can cause pancreatitis, because again, if you have liver problems, you've got that common duct coming down there, right? And what if I'm having problems that's causing fibrosis and stuff with the duct? Is that going to back up pancreatic enzymes into the pancreas? Pancreatic cells have lipid in them? Do they have starch in them? Does that amylase and lipase say, hey, I can't mess this up, I came from here? Or is it going to destroy that? So you can see problems like that with it, okay? And that's more common. That's why pancreatitis also is much more common in the cat, because where are our liver problems as far as fatty liver and everything more common in the cat? Okay. What about that? Does that look like a normal pancreas there? You can see the duodenum over there, right? That should be the same color as the pancreas, basically, right? So what do you think going on there? Got a lot of hemorrhagic pancreatitis going on here. What about these areas right here? Remember what that is? Those pale areas there, the white areas? That's soap. What made the soap? Some saponification of the fat. Okay, because what's the body trying to prevent? More damage by the free radicals released by fat necrosis, right? Okay. How about that one? That looks very good there. You think that's a very functional pancreas? Does that make you hurt? Would that be a little painful inside? Pancreatic pain. Have anybody ever had any problems with their pancreas? I haven't either, but from what I've heard, pancreatic pain can be excruciating. And stuff's going on right here. This is a histosection. Where's the pancreas? Gone. Basically, there's hardly any of it left. All you got is the fat necrosis and all that kind of stuff. Okay? So do you think you're going to get severe abdominal pain as one of your clinical indicators of pancreatitis? Yes, you will. Okay, there's a normal pancreas. You see acute hemorrhagic pancreatitis over there. Okay, this is showing acute interstitial pancreatitis. You can see those chalky areas in there. That's the fat necrosis, fat saponification of fat going on there. And basically, you're going to dig everything on the other side. Now, clinical signs, really specific. Fever, rapid heart rate, vomiting, abdominal pain, lethargy, loss of appetite, dehydration, respiratory distress, icters. Oh yeah, I know I got a pancreatic problem, right? So, they're very non-specific because they can affect so many different systems and stuff. So you make diagnosis basically on history, their clinical signs, blood work, x-ray, and ultrasonography. Amylase and lipase are the two enzymes that you most frequently measure as markers in the blood. Again, there's some other sources for those, so we've got a little more specific as far as that's concerned. Again, serum amylase could be a salivary gland problem if it's causing leakage of the saliva components back into the blood and stuff like that. But by far the most common cause of the increase in this enzyme is pancreatitis. Okay. Also, though, what did we say about how you get rid of amylase and lipase from the blood? Where's it go? It goes out through the kidney. Remember, most enzymes undergo half-life degeneration, as we said. The liver and kidney excrete the products. Amylase and lipase do not undergo degradation. They are excreted intact by the kidney. So what if the kidney's messed up? What's going to happen to those levels in the blood? They're going to elevate. Usually not to the degree that we see with pancreatitis, but it can elevate and confuse us. Okay? So that's one reason, the main things we use, but there are some other things which can cause the problems with it. Lipase is a little more significant as far as being more specific as far as the pancreas is concerned. And again, we've developed the isoenzyme that is specific for the pancreas. It's piece of pancreatic lipase activity screen, which tells us that lipase that's in the blood did come from the pancreas. Okay? Well, with the pancreas-specific lipase, PLI. Okay? And again, it's a snap test. And if you have a feline in practice, what do you think you better have available in your clinic?
Sedatives.
Well, besides that, this. Okay? This is a very common instance of this stuff. Okay? Well, would low levels of amylase and lipase tell you got pancreatic insufficiency? No, ranges start at 0. And so you can't use them to indicate pancreatic insufficiency. Okay, we don't use negative numbers. Okay, so what we use them for is elevations to indicate pancreatitis. Okay? There's also, as far as the SNAP test is concerned, it's very good. It's made by IDEX Laboratories. You can buy it from them, and basically, it's a much more sensitive indicator than just looking at blood lipase levels. Okay, so if you look at that, that's the one that would be your test of choice. Okay. Also, you're going to have inflammatory leukograms. You're going to have all kinds of stuff, hyperlipidemia, Basically, if the animal's vomiting, what's that going to do? It's going to dehydrate them and all this type of thing. Hypocalcemia, because it's pulling the calcium out to saponify that fat necrotic tissue down there. So in other words, there's all kinds of abnormalities you can see clinically with pancreatitis. Nothing really specific. That's why we have to do PATH, right? To get more specific with it. Okay, so here's your diagnostic plan. You have a case on the final. This is what they should be looking at right here. And do you want to feed an animal that has pancreatitis? You do that, what you're going to cause? Severe influx of pain, because you're going to cause release of more and more of that lipase, right? Yes, sir.
On animals with chronic pancreatitis, like constantly recurring, would you leave them on a low-fat diet probably for
The rest of their life. Yeah. If they have chronic problems with pancreatitis, then do you want to feed them one meal a day or small meals? Small meals. And you really have some highly digestible proteins and things in there, so that they will, good quality proteins, so that the decreased function may not inhibit those things from getting into the animal's body. Okay. And basically, the reason you want to do low-fat diets is because, again, what's the worst culprit in this thing? It's the lipase. Okay. All right. Then it depends on what the clinical signs of. You may give antiemetics or this type of thing. Okay. All right. Well, we're going to put here. We'll finish this up on Friday. We'll go through